Test.
1, 2, 3.
I can hear it.
Okay, yeah. Okay.
All right, we'll go ahead and get started. The closed caption says, is it working? Yes, it's up. So apparently the closed caption is getting us too. Had a little technical difficulty there to start, but we'll go ahead and call the meeting to order. The agenda does say 5 o'clock. We did have executive session from 5 until 5:30, and we're just a couple minutes late starting because of some technical difficulties, but we'll go ahead and call the,
Meeting to order.
this says July 8th, January 13th. We all signed it even, so. Yeah. The July 13th, 2026. Welcome to 2026. For purposes of roll call, all board members are present. A note for the public meeting that I think the board's aware of. I don't know, Dr. Martini come in. I may have said it before you got here. Mr. Ketchum will no longer be serving on the board. He has to resign his position. It does not have, it's a time conflict. So he's no longer going to be participating. We'll tender a resignation, and I thanked him for his albeit short but very positive influence and service on our board. We will be actively searching for a replacement. We can discuss afterwards, offline, what those specific professions are that are spelled out statute that someone that we have to draw from in order for someone to be on the health board. So. Next on the agenda is approval from October's meeting minutes. Those did come out. They were not out very long, but as we had a chance to look through those, go through those, I perused through them pretty quickly. Didn't see anything that's glaringly wrong, but I don't know if anybody else had an opportunity to look at them or not. They came in the.
I just had a question. At the bottom of page 3, it says, Tara reported 61 suicide calls to 911 with 2 resulting in deaths. To support harm reduction efforts, the health department now has medication lockboxes in stock for community distribution due to shown interest. Is that like Narcan, or what are we talking about there?
So our Narcan's different. So these are, probation had asked us about it, but if you have, if you've been diagnosed and prescribed like a controlled substance or just any pills, maybe a grandparent watching a kid at home or something, it's just a safe place to put your medications that lock. And then probation also, some of their probationees, I don't know if that's how you say it, they are required to, some of them are required to have their medications locked up at home. So that was just another request, but.
Okay, I saw that, like, right after the line for suicide, so I just was confused,
Okay.
but, okay, I got it.
I move we approve the minutes from October.
Motion by Ms. Pitts to approve. Is there a second?
A second.
Second from Dr. Carpenter. Any further discussion? All those in favor, say aye. Aye. Is there anybody opposed? I don't think so. Everybody was good. Next agenda item is Health Officer's Report. Dr. Welch.
I wanted to bring to the board's attention that there continues to be measles outbreaks across the country. The latest, one of the latest areas was in New Mexico. And apparently they have like a heat map through the several different organizations on a web call where you can look up, say you're going to be traveling to someplace and you want to see is that a problem. And the latest hotspot was New Mexico. I also want to let the board know that the area is dealing with a lot of respiratory issues, as was discussed earlier offline. RSV, COVID, flu, and also checked into the HIV funding. I was hoping that they would have, there'd be an opportunity in the non-budget year. There's actually a mechanism to look at an item, especially since the economic output has been much better than the predictions that were used as a basis to cut the HFI funding. It doesn't look like there's a appetite to bring that up this year from my reconnaissance work. And I will keep talking particularly to ISMA to try to lay the groundwork so we can try to get some of our funding back to where it was for 27. Along the HFI funding, one of the concerns was the health department helped contribute to the AED program. And I was a little disappointed that at no time did the media mention that.
It was a little tiny section in the paper. I was like, where's the health department?
Yeah, well, there was a number of things that didn't even list the health department. And no mention that we had started an AED program prior to this latest effort. And I know that their plan was to come for money in subsequent years for their long-term plans. And I think with them not mentioning it, it's going to hurt our dealing with our elected officials to try to get our HFI funding back so we could do projects like that. Just thought I would bring it up. Speaking of vaccines, it is a challenge for what is the appropriate recommendations. There's a lot of organizations, including the AMA, pediatric group, the AFP, and others that are trying to look at what is appropriate vaccine recommendations. I can tell you that the board at the AMA voted to only follow the CDC recommendations prior to the first part of May. There's efforts by different groups to come together to get a consensus, and that's ongoing. I have been pleased to see in the different areas that I've been involved, seems to be a growing interest in rural health, and whether it's workforce supply side of things, EMS, acute care. So I thought that was positive. The department did its first round of evaluations and did get to review some of those. And one staff person went to discuss it further and met with her this morning. But I think the ongoing will be a very helpful project. So we have a better idea what people's concerns are, and people have a better idea what expectations are. And I think ongoing, I think it'd be a helpful tool. I didn't know if anybody has any questions. Any questions online? Okay.
All right, hearing none, we'll move on. Next agenda item is Health Department's annual reports from 2024 and 2025.
I did email out the 2024 report because it had not been done, and I did have to submit it, so I went ahead and provided it to you. And then, right immediately following that, I worked on the 2025 reports. So I am going to kind of just, I don't know, maybe highlight some things on the 2025 report. If you have any questions, please do let me know. Probably the first thing I'll talk about, health maintenance, health trust. So it was your directive to kind of use those as a savings plan. I did do the annual report to the state for those. I did fill out the carryover request so that we can carry those funds over into next year. All revenue, however, is going to be going into the general fund account. We are, starting last year, we are not putting any collections into these accounts, so we are consolidating revenue. Oh, I forgot one thing. On the general fund, this is page 7, I put a asterisk next to the CVE tax. The county opted to consolidate where they are giving that tax to, so we are not going to be getting that tax revenue anymore. It's not very much, but it's just something that's different going forward, so I did highlight that. Most of, so funds that are kind of now defunct, along with the health maintenance and health trust, which does have a cash balance, we've lost the immunization grant. We have the cash balance in the school COVID, but again, no money coming in. The safe sleep grant is gone, but we did get the FEMA grant, I'm sorry, will be going through next year. That is a 2-year grant. Does anybody have any questions about funding? Sorry, I didn't print copies because I didn't want to waste paper, but if you do want to float around a copy, I can float that around. Okay. As far as special projects, we did complete the digitization of our vital records. So all of the ledgers are digitized. Yay! That was a month-long project, so I do want to give a shout out to Missy and Pilar, who put in a lot of time answering questions and assisting the photographer and getting the books set up for them and getting cover pages and naming conventions and all that. We are still waiting on, they are going to be sending us the, they still are doing some quality control work on the image captures and running the OCR, so we will be getting the data back hopefully in the next couple weeks. So with our vital records, the hospitals is going to be moving across the streets this year, so we will, going forward, our hospital births will be down, but we will still be issuing birth and death certificates. We're not going to turn anybody away, so so that we do anticipate that those numbers to continue. We just won't have as many birth records, but we still do quite a few amendment requests, so there's still a lot going on in the vital records department. Let's see. You want me to highlight anything for the clinic? I don't know. Status quo in the clinic? Do y'all want to hear from Candy about the state being in limbo about vaccines?
Sure.
There has been, unless I have totally missed it, there's been no guidance from the state in regards to the new vaccine regulations. I did miss part of the local health department conference thing this morning that was online, so I didn't get to hear all of it, so I don't know if they discussed any of it at that point, but nothing has come down.
And you said they're kind of trying to decide, like, I know the American Academy of Pediatrics is sticking with the old guidelines.
Right.
and Yeah.
AMA is recommending the old guidelines, but there's some minor changes between multiple groups. There's even regional parts of the country that groups of states that have come together for recommendations. And at the interim meeting of the AMA, there was actually a resolution passed calling on the AMA to be a convening body of interested stakeholders when it comes to vaccines, so that they can be a repository of information as well as a group recommendation.
So in the meantime, you're trying to decide if you follow the old recommendations or?
Well, like I said, I assume at this point that I will follow what I've always done because nothing has come
Yeah.
So,
like from
I would
anybody.
recommend that.
Yeah.
I
But just looking at this, it's not like they said, no, you shouldn't do any of these.
Correct.
It says shared decision-making
Correct.
for a chunk of them. So they're not off the table, so you can still have the same vaccines.
True.
Whether or not it's required for school or what, but they're still there.
And that's kind of where it's kind of tricky because school requires certain ones. And
Yeah.
parents are probably going to be more willing to opt out of vaccines if that is a choice. and there's a couple that.
Well, they do that anyway.
I know. There's a couple that I do on a routine basis now anyway, that have kind of been moved to that second and third category. I don't know, it's just kind of a wait and see. It's kind of like COVID all over again. Just changes on the daily, and you hope for the best, and you just do what you think is right.
In the meantime, we have a measles outbreak.
Yeah, but that one
That one
wasn't
hasn't, yeah,
dropped.
that one's not
That
been
was
removed,
not
thank
changed
goodness. Yes.
categories, even
Okay.
though it causes autism, it hasn't changed.
Yeah.
So no one is saying that you can't give these vaccines.
Correct.
Right.
It's just the recommendation.
Yes,
And
it
nobody
says-
really knows yet. I don't think anybody's had time to absorb it, to make any other firm decisions.
Yes,
because
it's
we-
just decision-making, so you have to, if they say, I'm really not sure about this one, then you have to sit down and have that chat, and here's, just
You
present the
almost have to
information.
do that anyway,
Yes.
if someone says they're not sure.
It
You
does
have-
make it trickier when she's
Right.
trying to, yeah. I mean, I will continue to follow AAP and AAFP for now, but I don't know what that means for the, like, in my office, but I don't know what that means for you and the,
Well, like I said, I'll probably just continue to go in the same direction that we've always been going until I get an official word from somebody higher up and more knowledgeable than I am.
And as of a couple months ago at a roundtable with insurers, they were going to continue at that time, their coverage to the pre-May recommendations.
And I think the only thing that they suggested were, I believe the second HPV is, insurance might not cover that second one if they stick with this schedule.
yeah.
That's the only information I have. Any other questions? Jason, I know you said you were going to make
No.
me speak, so.
No, and I did not prompt that. That was done outside of my, I just know you love to speak, so.
So just kind of on page 14, so we did do some Stop the Bleed kits. As you know, we did some AEDs in 2025. So there are
Few.
just some numbers of some educational programming that we did and some supplies that we got out into the community. Our FEMA coordinators hit the ground running. She's already knocked out 2 case abstractions, which those are brutal depending on how thick that medical record is. But she has her first team meeting is scheduled for February to review those cases. Pilar said she is going to volunteer to lead the spring rabies clinic, but we did do the rabies clinic last fall, so we tried to, especially with that outbreak that happened in Indiana, just try to keep cognizant of that. And we did have some meetings just with the county government about animal control, possible animal control ordinances or something. Really hasn't gone anywhere, but we are trying to participate and then kind of give the perspective of public health. There's some numbers. Let's see. On page 16, those are some of the events that we attended. Some of those were presented during the last October meeting, but you'll see the rabies clinic's been added. And then on page 17 is all the programs that were funded last year. Does anyone have any questions about the report?
Nobody? Nobody?
Does anyone have any requests for annual reports going forward? The only thing I'm required by statute to report is like our expenses, whether we have donors, and anything deemed relevant. So if you believe anything to be relevant that you would like to see on annual reports going forward, I would like to kind of track some trends. So as I kind of get data, I can maybe do some trend analysis going forward, but
Always good to indicate the positives of the participation you've had in the programs.
okay.
Anybody else? All right, thank you. Next agenda item is second reading of proposed health board policy for employee evaluations. Tara, it's up to you again.
Okay. So in last October, we did the first reading of the staff evaluation policy. I did make one slight change, so whether that means it's ready to be voted on or not, it was regarding the appeals and whether, basically how many board members wanted to be part of the appeals process. Something happened to the appeals page on what I printed off though, so.
So what's the pleasure of the board? Do you want to adopt this and have that number? I know we discussed earlier, some debate into that earlier. Do you want that number of people to be determined, or do you want to set a number as we approve it, or want
So-
to throw the trash and send it back for
So
not
current,
paying attention?
I'm sorry, what, say that again? I'm trying to read, go ahead. I'm bad at that, you can ask
Giving
them.
you a hard time.
No, I just said the other option was just wad it up, throw it back, and make you start over again, but you weren't paying attention, so it wasn't quite as funny as it.
I think we could approve once we know the number we want, but I don't know that we have to wait till our next meeting in 3 months.
Right.
Like, I would be okay with
So
an email or.
the way it's currently written, if the health officer sustains an unsatisfactory rating, the staff member may appeal unsatisfactory ratings to the health board only if the staff member receives 3 or more unsatisfactory ratings that result in placement on a performance improvement plan. The staff member may submit a final appeal to the health board within 15 days of receiving notice that the health officer sustained the unsatisfactory rating. The health board shall respond within 15 days, setting a non-public hearing to consider the appeal within 30 days of receiving the appeal. Testimony will be taken from the staff member, the health administrator, and any other witnesses the board deems appropriate. So actually, on this version, I did not change it, so I only changed it on the other policies. I didn't change it on this.
So this would be for, that, this appeal would be appeals to the board for disciplinary action that the health administrator has deemed appropriate due to the review that the health officer has agreed with or sustained is that?
So yeah,
So layman's terms, you fill out the evaluation, there's something wrong, there's some type of disciplinary action, sanction, whatever, they want to appeal that, it goes to Dr. Welsh, who currently, he sustains that or affirms your actions. If they want to appeal that, that's what we're dealing with now, correct? What we're discussing?
yes.
Okay.
And I do have 3 unsatisfactory ratings because for them to be put on a performance improvement plan, that was based on 3.
So it's like a 3 strike before it goes to the board.
So the way it's written is that 2 unsatisfactories doesn't really, it just results in coaching. However, if you get 3 unsatisfactories in that rating period based on the rubric, then you would be put on a performance improvement plan. So this isn't discipline in the way you're violating a policy, it's just a performance improvement plan to get your performance up. So if they've met 3, then they would go to Dr. Welsh. If Dr. Welsh agrees with the evaluation and the employee still wants to elevate, they would have 15 days to request to be heard by the board. Does the board want to say like 2 board members, the entire board? Do you?
And we have 30 days.
And then you'd have, it's whatever you, I put 30, it's whatever you.
Well, I mean, 30 days is what is in the, what was
Right.
written.
Yes,
currently.
yes,
I-
yeah.
I don't have a problem with what you all decide, just think in your brains about how hard it is to convene a meeting and try to have the entire board. And times, when we have to have special meetings, think about how, I'm not saying that it's impossible, but, it sometimes is a challenge to get everybody to,
A quorum is, I mean, we could put a quorum, but if we couldn't even
you know,
get that, we could do
we
less.
still have to have, right now, we still have to have 4.
Yeah.
Quorum, to have a quorum, so.
Probably do need an odd number though, because.
It's whatever you want.
Like 3 of them.
3,
Yeah.
If it's
3?
One, everybody got a tiebreaker.
Okay.
3.
Were there, after reading it, were there any other suggestions for change? Does the staff want to comment and have an opinion?
How are you accomplishing the 3 together?
The 3 unsatisfactory?
No. So how are you accomplishing?
The board members?
Are you establishing a meeting like this? Are you meeting
So it would-
somewhere else? What are?
It's a non-public hearing, so because it's non-public, it could be anywhere, because we don't
And are
need the,
you setting that up? Would the employee be setting that up?
I
I
think,
pick the 3 board members, I guess.
I think I think the way it's worded there,
Yeah, I have it worded.
Which 3 can come?
I said the staff member may appeal to the health board. We can put a point of contact on who wants to receive it. When I
The
drafted.
board would determine, based on availability, then the board would, once we're approached, we would have determined who the 3 would be.
Well, yeah, and
That's-
I'm just saying, is that Tara's responsibility to say, hey, this employee wants to meet with 3 of you? Is it the employee's responsibility to shoot out an email to all of you and say, hey?
Or we can designate the board chairman.
I
Or
think
you can
it's-
send it to me and I can send it to the
Well,
board.
the person, before they get to the board, has to see Dr. Welch,
Yeah.
right?
Uh-huh.
So he would be the point of contact. I would think at that point, he could say, well, our next step is to gather 3 additional, or 3 board members, and then he could make calls to whoever the president, well, I mean,
that's probably the cleanest way to do that. The administrator identifies that this person wants to appeal.
yes.
They contact the health officer. It goes through
Right.
that process.
It-
That person says, yeah, I don't like,
right.
still don't like what you're saying. I'd like to appeal to the board.
Yes,
Dr. Welch can initiate that.
yes.
and
Then they need to talk to him so that he can initiate that with the rest of the board, I think.
That puts the onus back on that employee because not that it would happen, but I don't want to say it's the administrator's responsibility to initiate that process, and then something happens and it takes 2 days instead of 1 day, and they get mad about it, and they whine, and just let them be responsible for initiating the process
Yeah.
with the
Yeah,
administrator.
I
to
would think
do
that they should be,
And then the health officer, and then the health officer will facilitate doing it with the board.
yes.
So I can make those changes, and then do we want to just bring it back to you at the next meeting with the changes?
I think you
3
can
months.
just email it. Does
Email
everybody
it.
agree with that?
Yeah.
Okay.
Do we? Okay.
Does it need signatures? Does it need like a vote? Does it need signatures?
Can we sign electronically?
Yeah, we've done that in the past.
Okay.
We've done it fast.
Okay. Are we ready for the next ones?
Yeah.
Okay. So I did draft a dress code policy. I did draft a cell phone policy. There has been some reluctance to turn on the GPS on the cell phone. The Ripley County Employee Handbook clearly states government electronic devices, there is absolutely no expectation of privacy. However, what I like about the policy that I've drafted is it states that if you don't turn on your GPS, it states what level of infraction it is. So if anybody, do you want me to pass this around so you can look at it?
This is the cell
Is it-
phone one?
We have an
Yeah.
email.
What are
That's-
the levels?
We have an email.
So there's like a
Yeah.
group 1, group 2, group 3. So group 1 is the lowest offense. So there were other electronic infractions that in the handbook were, like inappropriate use of electronic devices was a group 1. So I just classified this as a group 1 offense, so then it would follow the discipline procedure. So there would be a verbal written warning. After that, if there's still not compliance, the next step for group 1 is a 3-day suspension, continued failures to follow directive could, in theory, if it got to that, hopefully it wouldn't result in the employee's termination. Would you be interested in voting on it? Like, this could be the first reading. I could bring it back to you, the next one for vote. If that's how we're going to do it, first reading, second readings.
Pleasure of the board. Do you want to continue to do first and second readings? Do you want to?
Okay.
It does, I don't disagree with that. I don't, I think it may delay the process, and the fact that it's going to take 6 months for the administrator to enact a policy
Yeah,
Yeah.
yeah.
if we have to do a first and second reading. So,
Wait.
you know, if there's something that, I mean, we hire that person and she's supposed to run the department. I don't have a problem with some process where we vet the policies,
Once again, could the
but
second reading be
But-
shortened and electronically signed too?
Yeah,
Instead of waiting.
So,
Yeah.
so
3
just send it
months.
out electronically,
yeah.
and then we can just do them all at the same time?
Yeah.
Okay.
Yeah.
So, we want to track where people are all the time?
On the
If
clock.
they're going about government business.
Okay. So their GPS has to be on while they're at work?
On the clock.
It doesn't have to be on, and these are only for government-issued phones, not private phones. It doesn't have to be on if they're in the building, but if they're outside of the building, doing rounds around the county, or going to conferences in Indy or whatever, then this would require that they do have to have their GPS on.
And if they want to use their own phone, then they can not do that?
If they have a government-issued cell phone, and I think that is one thing I put in here, is that staff members that are either have to be on call 24/7 in case there's a health outbreak, or staff members that regularly do field work, that they should be issued a phone. So I can be more explicit that says, yes, if you have a government-issued phone, you need to have it on you when you're off-site, if that makes more sense, instead of saying I'm going to take my personal phone so I don't have to comply with the GPS requirements.
So, I mean, I guess to me, this seems a little bit much. I mean, but it,
Yeah, but people are going out and not doing their job.
There have been accusations from elected officials about if people are actually where they say they are. But it's actually a protection for the
Yeah.
worker.
Yeah, I think so
You can
too.
say, no,
It's
yes,
like a
they were,
body
and they
cam.
didn't see. And the
It's-
other
yes,
concern,
it's-
as we discussed this, was a safety concern.
Mm-hmm.
So if a member of the department is out doing their job, and all of a sudden they're
Missing.
they're missing. You know, did they have an accident? Were they accosted? Because there is growing violence against public health and healthcare workers. If somebody's missing, there would be, get them help. Remember a few years ago, one of the docs at Margaret Mary had an accident going to the hospital with snowy roads, and he went off the road down in a ditch, and if he had not had and this was like early time for cell phones, if he had not had a cell phone, he probably, God knows what would have happened, but he was able to, you couldn't tell where his car went, from over the embankment and down.
So, yeah, an extreme would be if one of our employees did something illegal during their on-the-clock time, and we were not aware that they were there, we would still be responsible for them because they're quote on the job, although we did not know that where they were or what they were doing.
Kenny, you and I are the only ones with government-issued cell phones, so now is your time to offer, that's here.
That's here,
yeah, the others opted not to show. So if you want to speak for them, now's your chance.
Well, needless to say, I feel like it's a babysitting maneuver. That's the general consensus, because we're all adults. I know what Dr. Welsh is saying, and that's fine. That should be discussed with that particular person. If there's evidence that they were,
So you don't
said
think,
they were somewhere that they weren't.
you don't think the group should be punished because of one?
Correct.
Staff member.
That's general, you're generalizing everybody.
If you look at other businesses, other than our business, there's lots of companies who have
Dispatch.
dispatched phones for their purposes of employee and work, and I think that it's not babysitting. I feel like it's, to me, it's not babysitting. To me, it's fulfilling the obligation of taking a government or a employee issue phone and using it, and even if you're not using it incorrectly, it's just part of the responsibility of taking on that position. That's just my personal, opinion. So I just feel like it's something that if you're going to take the responsibility for that job, that would be something that you have to take professional responsibility with. And so I really don't look at it that individuals are not responsible for their phone, because that is not it. I don't think, to me, it's not the personal issues and all that kind of stuff. It's the professional responsibility of taking on the job that you have to hold accountable for that issued phone, whatever company it is. I'm not saying I'm set in stone on that, that's just my opinion of issued phones.
But if you're doing it for the ones that have issued phones, we're not the people, well, the ones of us that have the cell phones, the work phones, we're not the only ones that go places. But there's other people in the office that don't have work phones, so they're not subject to this rule. So it's kind of like you're parceling just because we
Are they
we
doing
have work
jobs
phones.
that require them to have a
No,
phone?
but they are also going to conferences and meetings that they're supposed to go to. Who's to say that they're not saying,
So,
I'm going to this conference or this meeting, that they don't go?
so
So they should all
the,
Making out-
They should all have a phone then. When they go to a conference, they should,
the staff that do not have phones, just to clarify, Missy does not have a phone. Just so you know, when Missy went to the conference, she actually provided me proof that she was at the conference.
And if that's what you
we could do
require,
that.
then that's fine.
Pilar does not have a phone, but again, Missy and Pilar's primary function is to sit at the desk. Yes, they occasionally may go off-site to assist with something. I think everyone else has a phone. Because Tracy, Alicia have a phone. Kirsten has a phone. You have a phone. Cindy, the maternal child health coordinator, does not have a cell phone, but we don't have a maternal child health coordinator right now. But that person.
It says GPS tracking is not common with office administrative roles, like it is with EMS or snow plows, public works. I mean, to me, it just feels a little like a violation of their rights.
Yeah, our EMS, our fire, our police, they have radios, they get dispatched, so their location is known constantly. I have field personnel and that are at site, and I don't know if they're there or not, unless they share their location with me.
To me, it feels like a trust thing, like, right, you should be able to trust your employees.
I will say this didn't come from, this wasn't just this was to solve an existing problem, so.
This point of clarification, there was reference made to public safety, some fire, police and EMS. At least in this county, police and EMS are dispatched by radio. They go to an incident, they're obviously supposed to go to hospital or wherever and then go back to the station, but all those vehicles are tracked by GPS as well. So dispatch knows where all those vehicles are at 24 hours a day, 7 days a week. even if granted, those are vehicles owned by the government, but even if that individual is off duty, that obviously doesn't apply to EMS. We don't get to take the ambulances home and ride around, but the officers have off-duty use of their vehicles, and those are all tracked 24 hours a day, 7 days a week.
So-
And they're being tracked while they're using them for personal use, because they're allowed to drive their car to the grocery store and stuff like that, and they're
Yeah.
always on. So they are kind of having their privacy invaded that way, but that's their choice to drive that vehicle for the personal use too.
So if there is not a consensus on this policy, does it have to be voted on if on open record? Because if I'm sending it for signature, but it is not unanimous, I don't know if that requires a vote.
I think I'd just like to point out that when the people are at a conference, they are still our responsibility. They are our employee, they're our responsibility, and if they are not where they say that they are, and that's that's not the only reason for this, because I agree, we need to do it for safety reasons also. But that comes back on us. So if something would happen to them because they are supposed to be at a conference where they are not attending, or they're supposed to be at a home visit that they are not, and something happens to them, they are still going to be our responsibility.
The other thing, if there's a concern that some people don't have phones, would be to assign a phone for those times when someone is away from the
Yeah,
office.
just when you're
and
gone.
Is at a conference, and so it's
Yeah.
more equally
Okay.
Yeah.
applied. I mean, you don't need it when you're in the office because you're in the office, but if you're out of the office, then maybe the people who don't have as much need for a phone should get a
Okay.
Temporary.
temporary phone for those, and then it's an equally applied policy. And there's no special exceptions.
Is the vote has to be unanimous or majority?
I believe we just have to have a majority.
Yeah.
Is there any more discussion before we vote?
And this is like just a health department policy, it's not a county
Right.
employee policy?
Right. They do have a cell phone policy. It does not, this county cell phone policy does not specifically say GPS. It just says the general, like for technology, cannot be used for personal purposes, don't commit crimes on it, and that kind of stuff. And then I have a policy for, like, administrators kind of have a policy on how we can go about getting into cell phone contracts and stuff like that, but.
Do other county agencies and departments that have cell phones that are issued, do they have internal policies that you know of that they're following?
Within Ripley County or just around?
Any area?
I can ask. I mean, like I said, our law enforcement has other means to track, so if they have a government-issued cell phone, that would be on top of the other means in which they track, so.
Any other discussion? Before we vote, I'm going to say that I'm a government employee. Big Brother knows where I'm at 24 hours a day, 7 days a week. I take that responsibility. I know that by accepting that phone to be on call 24 hours a day, 7 days a week, I know the government knows where I'm at all the time. And
Probably if you're
It's
not
rel-
an employee, they know where you are.
and if it's easily accessible, this one that the government does not pay for directly, I'm sure if someone needed to know, someone that really needed to know, wanted to know where that phone was at, they could find that out too.
Yep.
So. Any more discussion? All in favor for moving the policy forward, signify by saying aye. Aye.
Aye.
Aye.
Any opposed?
I'm opposed.
Okay. 5-1, motion moves forward as a majority. Or did we decide that we're going to do a second hearing then by email? Did we decide that earlier,
Okay.
before it actually is official?
And then we'll collect signatures then when it's sent by email?
Yeah.
Okay. All right.
Was that going to be added about if anyone is out of the office?
The loan.
But
Yeah.
that-
Yeah.
I can, so the vote was subject to adding
Yeah.
the loaner provision.
Loaner for, so that it's equally applied across the entire department that way.
Go to the stove, I need the loaner phone.
All right, there is going to probably be some comment on the dress code. I did create a dress code policy. When I started, I did ask staff to not wear jeans and T-shirts, even for the field personnel. In my opinion, there is plenty of field clothing, durable clothing that can be worn in both kitchens and in when looking at doing septic inspections. I was a farrier. I was under horses in horse manure, and I never wore blue jeans. There's plenty of clothes, and I wore my polo shirt with my business logo. But it has received a lot of pushback. So if the staff wants to provide comment, now would be a good time. You're the only one that showed up,
I
Candy.
think
The other
before,
ones didn't show up, so.
I think
you would-
before staff comment, I want to make a comment that I reviewed this. Obviously, a professional image, all that good stuff, that's paramount, that's viable. I do question, and it may be something for someone, as far as a legal counsel opinion, I don't know, to dictate, and I know that you have provided everybody with a shirt, so that's a good thing, that's a start. I just don't know about, and let me preface this by saying the policy is not very specific, as in you have to wear a purple shirt with pink polka dots. It's not that specific, so that is a good thing. But I don't know how far we can drill down and require people to wear certain things if it's not provided and/or there's no clothing allowance provided for that.
That is something the clothing allowance is something Dr. Welsh and I have discussed. I didn't do it in a session, but I have talked to some counsel about it. So we are hoping when we do the budget for next year, we would like to address trying to get a clothing allowance for the field, people going into the field, not everybody. But that way, if a item of clothing is soiled in the kitchen or in the field or something, that we could replace that item at no cost to the employee. So that was something that we did discuss, that we would try to get that line item passed in our next budget.
Is there I know it wasn't thought of last year when the budget was created for this year, but is there a reason to wait an entire year to try to introduce that? Is there the ability, and I'm showing my ignorance to our budget, is there ability to move money in order to do that now?
The only thing I can say to that is the highway department tried to get a budget for boots for their people, and the council denied it. And when I followed up afterwards on why the boot clothing was denied, the objection was specifically because they should have done it when they passed the budget the first time. So that's all I have to go off of. It doesn't mean I couldn't try. I could certainly try, but.
I think that was put forth as an additional appropriation, so
Not
they were
as a
asking for more
okay.
money. I asked, and I don't know, this is why I'm asking, do we have money internally that we can shift in order to cover this, and then for the 2027 budget, add it in like they're instructed to for highway? so that it's actually added moving forward, but.
There is
we-
funding.
We hicked up, we need to figure it out now.
It is, my understanding is it's still an additional appropriation because the accounting code does not exist yet. So you're not just it's not a transfer of funds because you're not moving it from one line item to another line item. You're actually creating an accounting code that didn't exist before. So that's what, to my understanding is that is an appropriation. But I can talk with Amy in the auditor's office about how
How to be.
to do that.
How to be creative with the budget line items. Because I think, I mean, you've got a line item somewhere that says supplies. These are employee supplies. I get it, it's not
Yeah.
exactly what you meant when you budgeted for supplies, but, if you're gonna, and then you can, I mean, that, you could have it where they have a specific vendor, you could choose a vendor, you could say, you pick from these 6 different shirts or whatever, and they picked from those 6 different shirts, and you pay for it.
And just so you, the whole board is aware, with the shirts, they were allowed to pick the shirt they wanted because not everybody type is the same. So after they picked their shirt, they had like a budget they had to stick with. Then those were sent off to get the health department information on them, so.
So maybe it sounds like that since that was the route that you went down for that there's a method that already exists. You just have to make sure there's enough money in there to
Okay.
cover more moving forward. And again, your policy, but we're tasked with approving it or blessing it or whatever you want to say. I'm just going to go on record saying that again, we talked about prior policy, what's good for one is good for the other. If you're going to provide field staff with
Work camp.
uniforms, stipends, whatever you're going to do in order to do boots, pants, whatever, the office people are required to wear certain attire. So
Yeah.
you have done that with
It
providing them with
is.
a shirt.
Yeah.
Things like that.
So you
So-
can't, what we have to navigate is you can't use government funds for personal use. So you can't use government funding to buy, I don't know, socks, because those are your personal socks. But the way they word it is like, if you need a safety toe shoe, that is not something you would wear for personal reasons, but that's something that's required for work, then that would be approved. So there is kind of that fine line, what is work-related clothing versus your personal clothing? Which is why, for me, if it's got the Ripley County Health Department logo, that's clearly a work shirt. But I can't buy the front desk staff a blouse, sorry, Pilar, because that would be your blouse that you could wear wherever. But where I'm kind of walking that line is if you're in the field, you need a durable shoe. You need a kitchen safety, non-slipper, slipper-resistant shoe. If you need like a safety toe or something, doing septic inspections, I don't know. So we just have to justify it to say it's a work clothing, not a personal clothing.
I think anything, I agree with what you just said, 100%. Anything that's purchased for an employee remains the property of the department. So,
And Cindy did give me her shirts when she left.
all right, proof positive then. We bought Cindy shirts and she left and she turned them in. So, they're not hers to keep for a rainy day to mow the yard in or whatever, so. Anybody else? Just keep looking back and forth.
Candy, how do you feel about it?
The only point of contention that I think Sarah and I kind of got into it is my baseball team, but it says Ripley County Health Department on it. So if this is not allowed to be worn, it says Ripley County Health Department on it. And so I've apparently gotten in trouble twice about this.
Was that something
That's
that
the
was
only-
given to you from the department in the past years?
Yes.
Was it for like the county fair or something, or was it just issued?
It was just issued.
Okay. I would think
Because I
if we
also
have like a,
gray t-shirt
I,
that says Ripley County Health
I
Department.
mean,
on it.
if we're doing like county fairs and stuff where we have like dress down days, I think that would be a perfectly decent shirt to wear. But I feel like that if you're not gonna wear that at the clinic
If she's not going to wear it in your office, she shouldn't be wearing it at the health department. But
I don't know, I mean, I don't know the right answer. To me, this feels also a little bit much, I guess. I don't know, I think my approach in
I
general
grew
to
up
other
in
human
Catholic
beings.
schools. We
Yeah,
had really
yeah.
restrictive.
Yeah.
I'm old school
had
too.
I wish
So-
Mr. Ketchum was here, because when I'm looking for an employee in the next few years, if you see what the kids are wearing in high school today,
Her t-shirt that says Ripley County Board of Health should be perfectly fine to wear into the office, because she's representing the office.
Yeah, I don't know, I guess my approach in general to other human beings is like letting them make their own judgment on things, and I don't often tell my staff what they should do and when they should do it, and so, to me, all of this feels very like much, and so I don't know the right answer, if there's like a problem we're trying to solve with this, like, maybe I need to understand
Somebody
that.
coming from the community and someone who's got a military background.
Yeah.
I also
Yeah.
went to Catholic school, so.
Yeah.
Well, and of course, then I have the hospital background, because you don't expect a nurse to wear whatever they want to wear to work.
Right.
We have expectations, if their shoes are dirty. I mean, just, you would,
those are
maybe this is
common
different because it's not, but, again, I'm
Maybe
just
not
kind of
everyone
old
has
school.
the same Common sense.
Yeah.
Just for your
We expect a
This is
a nurse
business.
to,
The the Ripley County handbook basically just says dress professionally, and that's the term they use, and they leave it at that. So however you determine professional without further guidance is up to the individual to determine what they think is professional, so.
But, I mean, even in this, there's some, like, it says, shoes, you can't have overly casual sneakers. Like, what does that mean? I mean, I don't know. I think that it feels like,
When I go to court, I have to have my suit and tie.
Right, yeah.
But if I know I don't have court one day, like Wednesdays and Fridays, normally I'm not in the courtroom, I wear blue jeans to the office. So I don't, and I'm an attorney, so I don't see where blue jeans is an issue.
are you,
But does
and
the-
you're interfacing with clients?
Yeah,
on
does
those
patients
days?
come-
Sometimes have victims come in that I have to talk to, and stuff like that. Now, shirt-wise, I always have either a polo or a button-down on, but I will wear blue jeans to the office. There's no holes in them. They're, look nice blue jeans, and we're allowed. My boss wears blue jeans to the office when we don't have court.
My staff's not allowed to wear blue jeans.
Okay.
It's company policy. In the pharmacy, you don't wear blue jeans. So,
yeah, in nursing,
no
I
no
don't, we
sneakers,
don't
no
wear,
open-toed shoes.
And I get it.
we don't
And
wear
that's
jeans
only-
to work, at the hospital anyway.
And like you said, nurses are normally in scrubs, doctors.
So we're talking about health, and we're talking about
Public health.
public health, and, which is a lot different than, a lot of different, and even, Doctor Carpenter's office, it has a different feel about it, I'm sure. Maybe a little more relaxed patients,
and I'm
are
not
the,
saying that, I don't wear jeans, I don't wear jeans to work. However,
Why
I
not?
do, because I think it's kind of like a sign of respect to the patients. But I
Okay.
wouldn't, I don't know, I guess I just don't feel like we have to tell people you can't wear this t-shirt that has Ripley County on it. Like, I don't know, that
Yeah.
to me feels like a lot.
yeah,
I'm one person, that's my opinion.
yeah, right.
I did put for the clinic optional scrubs, that they don't have to wear scrubs, but that it is an option if they do wear scrubs. I did put some stipulations that the scrubs be appropriate, but I don't know if
I did
that's.
have some scrub pants on. I'm like, yeah, this is normally what I wear.
And
That
there's-
just happened to be the day
I don't think we would be doing this as a policy if there wasn't a problem.
Yeah, that's what I
And not
think.
just a single problem.
Yeah,
I think
that's
it's
what I
been,
think. Yeah.
I do have a staff member that is continuing to wear jeans and t-shirts to work and showed up in her employee evaluation in jeans and t-shirts.
I don't know, when I asked the state what their policy is on this, and they said they dress for the day they're gonna have.
They don't interact with the public, do they?
No, this is my one, my disease person that does our public health nurse meetings. And that's just what she told me, that they all dress for whatever day they're gonna have. So if they're going to a meeting, then they dress this way. Like when she comes to meet with us nurses, she's pretty casual, pretty fun. So it's just.
No, I think I'm going to sneak out.
Everybody's got a different opinion.
Like a game.
Is there like a middle ground that people would be happy, or like the staff has asked for any particular things in dress code, or not necessarily?
They would like to be able to wear jeans and t-shirts
Like every day, or just?
every day.
Because I know some places, because like Fridays are Students' Day, and I think a t-shirt with the county board of health on it should be fine, but
I did put,
that's something to
Yeah.
in
appropriate.
In section 4, it says casual dress down days and events that I could be authorized to allow for dress down events, but that when I'm considering it, I should consider what the forum is. So if it's the fair, that's going to be a different forum than like when I went over to, they just started, I forget what they're calling themselves, but basically like the senior care got together and met at Allure last week. They were all dressed very nicely. I was actually underdressed in my polo shirt. So I think if we're gonna do dress down days, we certainly need to consider what the forum is. I don't know, do you wanna do a dress down Friday? Because Missy asked if we're doing the Saturday clinics. Should Saturday clinics be more casual than the weekday clinics? I don't know how many
I mean, that's,
people typically come in on a Saturday, but
I don't know, because on a majority,
I would say.
I've got my scrubs on. Whether I've got one of my vaccine t-shirts, health department t-shirt, my bottom part is always scrubs. So that's usually my standard uniform. I don't, probably the only time I do potentially wear jeans is at the fair.
And I think the forum does have something to do with it, because I don't know who was there last Saturday at the YMCA. It was you that, I joined the Y and I got handed a packet from the health department, and I don't remember what she wore, but I wasn't focused on what she wore, but there she probably should have been more gym attire, because we were at the gym.
true.
I don't remember what we wore.
I know, you were walking in as I was leaving,
Yeah.
and you handed me something, I thought it was you.
You had a Ripley County polo on.
Oh, okay.
Yeah, so did I. I had a Ripley County shirt on.
I don't know the right answer. I just think maybe it's worth making sure that the staff feels like they're heard on this, and then coming to somewhat of an agreement. And that agreement could be what you wrote, which is you dress
So
nicely. And then
It's here
sometimes-
because we are not coming to an agreement.
Okay.
Fortunately, I haven't had issues about tight revealing clothing that exposes inappropriate body parts, but I'd like to have a policy before I have to have that conversation with the staff member.
I don't think you have to worry about that one.
That depends on what high school intern you bring in. Fortunately, the last intern was
Yeah.
just good.
I don't
But I
think they
guess
can do that without.
If we all wore a uniform like scrubs, we would all give an exact similar image, like if we were in a clinical setting. I think that would, no, that would solve everything. It's like, okay, and it's great for us. It's like, I don't have to think, oh my God, I have a uniform and that's.
I wear the same uniform every day this week, nobody's gonna know.
My gloves,
Yeah.
I love the scrubs. That, for me, that would be. Comfortable. I'm very, that I'm very open, but scrubs I think would solve everything.
Except for the people going out and septic.
Restaurant.
Yeah, restaurants, it's,
Scrubs would still work with restaurants. Actually, that was a discussion I had with somebody in the staff this morning, was saying how clothes had been damaged. I thought scrubs would be an easy thing. One, if it got damaged, it could be replaced more easily, and it's easier to clean. Second, and I actually responded that I was concerned that they were in a situation where they actually had clothes damaged. And I said, I asked specifically, was that written up? They said, no. I said, in the future, that should be written up, but that's a safety thing. So if the discussions open up a lot of the things of consideration, but I think scrubs or scrubs with, Ripley County polo shirt type of thing would show, some degree of professionalism, and I think it would be a positive response from the public.
I think the people going out in public probably should have something identifying that I'm part of the health department.
Right.
Yeah. You're walking into a restaurant to do some sort of inspection, and you're just wearing a plain t-shirt with no identifying marks on it. Who's the restaurant person say, oh yeah, I know who you are.
Would you like me to add that to the policy? I can print ID badges. I just got our ID card printer back from dispatch. So it could say something identifying whether it's your badge or whether it's identifying clothing. Alicia got like a purple reflective shirt. Doesn't say, yeah, it does say, it says on Ripley County on the sleeve, but.
And that would actually be helpful when we respond to disasters, some sort of identification.
Absent of that, they won't let you in.
Right, exactly.
So-
I actually still in my car have an old badge.
Do you want,
Ripley County Health Department.
for the IDs, do you want me to list that in a separate section or just put that in with field personnel?
I don't think that comes with attire, but I think
Okay.
having badges is probably
Okay.
not a bad idea, especially.
I have one.
I've got one that's in my garage, I haven't used it like forever, but,
Well,
I think everybody knows who you are, Dr. Walsh.
Yeah.
well, see, and that's kind of like with Tracy, she usually wears a Ripley County Health Department shirt, but there isn't too many people in this county that
Don't know who Tracy is, yeah.
Yeah.
So you're thinking this, and if not this, then a Ripley County polo or something that's labeled or scrubs? I mean, I feel like that would make people happy if they had an option of, like, if it wasn't dressing up, then they could at least wear a polo if they had money, or scrubs. I don't know what, I'm just trying to repeat back things I heard.
So for office personnel, it just says dress shirt, blouse, or professional tops. I don't feel like, I could add like a polo to that to be, I didn't specifically put polo. And then for pants, it just says for office personnel, slacks, dress pants, skirts, dresses of appropriate length. For field personnel, it says field attire must be durable, functional, and professional in appearance. Open-toed shoes are not permitted for field work under any circumstances. Footwear must provide adequate traction, protection, and support for the work being performed. And then I listed out, I did say, like, if you're out in the field, that I do recommend, like, taking an extra pair of shoes or something so that you're not tracking that mud back onto the carpet. Because if an employee has to go home to change clothes, how do we want to handle that? And then I did list some examples, so it's not an exhaustive list, but it just includes durable work pants or slacks, long sleeve shirt sleeves, collared shirts. So that could be polo or button up. Protective outerwear appropriate for weather conditions, high visibility clothing when required, slip resistant shoes for kitchen or food service, durable protective footwear for septic or similar field work. So it's not, I don't view that as narrow in interpretation. But if you want me to add things to it, like I think, I could add the word polo,
Considering we all got polo.
yeah. But it surprises me that I bought people shirts and they're still wearing t-shirts. I should say the county bought, because I didn't personally pay for them.
My polos I wear when I go to conferences or whatnot.
I still, if we want to require certain attire, I don't know, I guess,
Do you want to wait and see if we can get the clothing allowance passed? Making it contingent upon a clothing allowance to assist with?
I just think when we specify certain things that, and I mean, we all know that our employees don't make enough money as it is, but you're specifying they have to wear certain things. If they don't have that, then they have to go buy those certain things. That's an added expense. I don't know.
Well, we had discussed earlier today that if we go the route of the polos, basically each year, if it's part of the budget, we can issue additional shirts. I have a whole collection of Margaret Mary shirts from golf outings, so, but, somebody who's been here after a number of years, they're gonna have no problem with that, and I know folks who so I went to Catholic school too. A lot of parents like the fact that it was actually less expensive.
Like I'm in the minority here.
It
That's what
levels
my
the
mother
playing
always said.
field.
Right.
It doesn't matter what your
Right.
financial situation
Right.
is at home. Everybody goes to school in the same
Right.
clothes. There's no judgment, so.
Yeah.
I like the idea of having some sort of allowance, if that's possible.
So just be a little bit less into the specifics, just like paraphrasing more.
When it comes to the ones in the field, you may want to put it in the job description, because what you described were safety things.
Okay.
No shoes, safety boots, and so forth.
Yeah.
That could be under expectations for those jobs.
It says employees work in the field must wear field appropriate clothing suitable for their job duties, work environment, and applicable safety requirements.
But what I'm saying is in their job descriptions, you can have, these are recommended,
Like say
strategies.
which field personnel it applies to by job description? Or saying
In their
when they're
actual
job. In
hired?
their
Their actual
Absolutely.
job description,
Okay,
because
I
what you
mean-
described were safety
okay.
components.
Can I make them re-sign a new job description?
That's always,
It could be phased in to allow time to purchase the appropriate clothing,
Yeah.
say over the,
Yeah, it might be a little easier
I
to
like
stick that way.
his idea of dress down Friday.
Everybody's for dress on Friday.
it's the same.
I know, but I've been the minority, I guess, I don't know.
Everything's too cash.
Yeah.
So, am I hearing collectively, everybody, that we want to kind of, I guess for lack of better options, we want to table what's here? We're not saying no, but we're not necessarily approving what is here specifically verbatim. And Tara's going to go back and try to investigate some allowances, potential for allowances, and see if we
Make
go,
it
see if we go
more-
down that road.
General and less specific on. So, Dr. Carpenter, you don't like the things like saying t-shirt, tank top, halter top, sleeveless shirts. That's the kind of language that you're having, that you want me to remove, or?
No, I'm not saying you have to remove that. I just, it sounds like you would like people to dress nicely at work, right? So this is the people in here, I'm thinking what you're referring to for this first part, right? Not going out on a job site. But is there an option for those people? Like Candy said she likes wearing her scrubs, and Pilar
I
said
think
she would
scrubs were in there.
like scrubs. So is it optional for everyone to possibly wear scrubs if they want, as opposed to like a more casual option, or the polo with the logo as a more casual option? So there's the option to dress up, but then there's also these other couple options that would still feel to you like they were appropriately dressed in here?
I didn't specifically put polo, but polo would certainly be an improvement, and the shirts that were, some of the shirts were issued were polo. So I can add polo. I can change clinic personnel and optional scrub attire just to say optional scrub attire, so anybody would have that option.
Because I think as long, like, some people will dress up and that'll be great and that will make you happy, but I think there's some people that maybe don't have those clothes or don't really want to wear those clothes, and if there's an option that feels good to you for them, like the polo or the scrubs, I think that's a win-win.
Does the, people don't get offended if you wear scrubs and you're not a medical professional, do they? That's the only thing I would worry about.
They might
It's kinda like
assume
putting
you're
it-
a medical person.
Yes.
does that create, I mean, we're the health department,
Right.
but if I wore a scrub, someone's gonna mistake me for
You
the
know what?
clinic nurse, and I'm gonna have to say, sorry, no, I don't know.
Drug reps come to my office for lunches and
And
scrubs.
scrubs. Okay, so it's not gonna be a
It
social.
started with COVID.
Okay, so there's no social taboo on that, okay,
When my sister worked there, she was in the kitchen and scrubbed.
okay.
I think that this whole thing is based on, that we would like for them to be in business casual,
We like
to
to
look
be
nice.
professional.
I don't think we want worn T-shirts from 2 or 3 years that have seen 100 washings. I think that's what you're asking for.
Yes.
I don't think you're trying to deny anybody their job. You're just asking them to be respectful and to dress respectful of the position
Yes,
as a public employee.
Yes.
Is that correct?
yes.
Okay, that's what I get from the whole thing, okay? So I think if the staff would understand, you're not trying to single anyone out, you're not asking them to go invest in a whole new wardrobe, you're just asking them to dress appropriately for the job as a public employee. Maybe,
Having that.
A public
When,
health employee.
when
Public health
when I
employee.
did have the conversation, I have my witness here, and I said, let's do better than jeans and t-shirts. The response was, well, the auditor's office. Everybody else in the building wears jeans and t-shirts. So I feel like I've tried to explain the why behind this, and it's still meeting resistance.
Also, you've got years of.
And some employees are gonna be retired in 2 years, and they're not gonna do it anyway.
But I'm just saying, you've got years of being able to dress, not like crud, no holy jeans, no, none of that. But dress a certain way because of the jobs that they're doing. They've been doing it for years.
It reminds me of I recently saw an interview of the cabinet secretary in charge of transportation.
About pajamas on
Yeah, so
the
he'd
airplanes.
like for people to actually dress more appropriately on airplanes and not show up in pajamas. And I thought, yeah, having just flown, I know exactly now what he's talking about.
it's not just flying, they're everywhere, so.
I flew standby, I always had to dress nice. I didn't have that option. Okay, so work on clothing allowance, be a little bit less. Sorry, Dr. Carver, could you say that again? So put the scrub attire or polo as optional attire. And
Like
then-
business casual, and then you have these other options, so.
Okay,
For in the office. I mean, if you're in the field, you need clothes that are,
Yeah.
Appropriate
For the field.
conditions.
okay.
But I hope that in the field that they're not arguing the open-toed shoes.
They are not, this was just a stab at, if I ever have that conversation down the road,
Okay,
this
good.
policy is gonna be good until the next administrator and however long does have to have that issue.
Especially with septic, I hope we're not doing open-toed shoes with
Yes.
septic. Sorry. Okay,
Okay, so I'll rework that and then come back to it.
Okay, I think was that it?
All of those?
Oh, the employee discipline. Thank you, I remembered. So currently, as far as appeals, the Ripley County Handbook for staff appeals for discipline, not for evaluations, but for discipline, says that you can appeal discipline to the commissioners, however, the commissioners' findings are completely not binding. So I did want to give the staff a way to appeal if they've been given some kind of discipline. So that is a one-page, and then I think y'all said for the employee appeals, 3 sounded good. Do we want to put that at 3 for appeals to the health board for discipline?
That sounds good to me.
Okay. Is that something that you feel is ready to have a vote on? Does it need revisions
I think we could vote
pending the change for the,
3.
Is that a motion to accept that policy and move forward?
Yes, I move, we accept that policy and move forward.
Second for that?
I'll second that.
Second. Any more discussion? All in favor?
Aye.
Anybody opposed to that?
oh, I'm done.
Creating the appeals process. Next agenda item is Health Department staff comments.
Thank you.
Ken,
I've been thrown under the bus enough.
you want more comments? Stand up and say something you like about your job, or something nice, or something.
Thank you for being here this evening.
I
Yeah.
like my people that come in.
Okay,
I like my patient interaction.
good.
And we've been discussing the allergy shot, and you said about 8 or 9 is what you said.
Give or take, yeah.
Okay. And they're pretty consistent?
Absolutely. And most of them are on their maintenance doses. I think I only have maybe 2 that are on the beginnings.
And Dr. Carpenter was asking earlier, do most of those people have primary health care positions? They do.
Do
Okay.
they have an option of getting those there?
They probably do, but like, I know like KDH stopped doing them. They used to do them because people would go there. And that's how I ended up with a couple of people. They just, when they're doing them, some have to do it once a week. When they're in the beginnings, they have to do it 3 times a week. They just don't have the time to drive to Madison or Columbus or wherever for those multiple times. And since they work in the area or live in the area, it's just easier to come here.
Okay.
Might be interesting to know why those physician offices quit doing that.
And that I have no idea, because I was doing them over there when I worked there. So
Yeah, I mean, that's obviously a
I'm
patient
sure it has
physician
something
thing,
to
but
do with when they changed, when Norton's bought them out, I'm sure it was probably some kind of policy that they had, maybe, I don't know.
But you would say a lot of them are patients at the Norton Clinic here?
No, the majority of the ones that I do shots for, well, all of them that I do shots for go through Madison Allergy and Asthma.
Okay, but a lot of them have their primary care?
I
You
don't
don't
know.
know.
I
You
don't
don't
know for
ask.
sure.
Okay.
all right. Next line item is public comments. There's nobody from the public here, so the next one will be next meeting schedule.
Is it April 14th? Is it the
April
second
14th.
Tuesday?
I thought we had that list.
April 14th.
April 14th.
April 14? Okay. It's not on there, but we all are in agreement? I think I sent that out, actually.
You did.
So,
July 14th and October 13th.
all right.
July 14th, and I expect a birthday.
Is it your birthday?
Is it, okay.
I'm the 14th.
July 14th.
Okay.
Bastille Day?
So it's not here, but any more comments for the good of the order from anybody? Hearing none, then we will have a motion to adjourn. Motion, second. Stand adjourned. We're all in favor of that, right? Nobody's against
Everybody's in
that?
favor of that.
Okay. Awesome. Did you shut her down, Laura? Are we off?